Hello everyone. Today's interesting topic is mucormycosis or the black fungus. So we'll see step by step about this topic. Kindly watch the entire video to understand. Welcome to Logic Medico, where we are understanding the concepts in medicine. What is this mucormycosis? It is a serious but rare fungal infection caused by a group of molds called Mucormycetes. What is the other name of mucormycosis? Everybody remembers mucormycosis or the black fungus. So what is the actual old name for mucormycosis? It is called, it starts from Z, Zygomycosis. What is this mucormycosis or the black fungus? It is a fungal infection affecting the patients with weakened immune system. Now COVID-19 is there, so this COVID-19 will reduce the immunity of the individual, and also steroid given for the patient to reduce the inflammation also reduces the or weakens the immune system, because steroid is a immunosuppressant. What are the types of mucormycosis or zygomycosis? There are basically two types. Pulmonary mucormycosis, which affects mainly the lung tissue. Okay. The second one is rhinocerebral mucormycosis. That is, mainly it affects the nose, palate, the orbit, as well as the brain. Rhino means nose, cerebral means brain. But it also affects the neighboring tissue as well. Okay, black color structure will be formed, that is mold or a fungus, mucormycosis. There is also other type of skin type which is rarely found. It's infected weapon is used on the skin, that is cutaneous mucormycosis. Okay, let's come to the next topic. What causes mucormycosis? It's mainly the fungus belonging to these two genus, the Rhizopus species and the Mucor species. So there are two types of fungus here, the Rhizopus and the Mucor species. They are usually found in soil, spoiled food, and in the environment. So they are freely available in the environment, especially in the soil. What is the life cycle of mucormycosis? See, basically there are two types of life cycle, the sexual reproduction and asexual reproduction of this fungus. They will be available in the form of spores in the soil so that they can survive all types of temperature. Also in the freely available in the environment. The spores will germinate whenever a humid atmosphere is available, and it will form the mycelium. So there will be sexual reproduction of the two gametes, the male and the female gamete, to form the mycelium. The mycelium will produce the sperm and the life cycle continues. In asexual reproduction, the spores directly form the mycelium without having the gametes, that is asexual, like this. The sporangiophore will be there, they will directly give rise to the spores without any meeting of the gametes. So there are two types of life cycle, the sexual one and the asexual reproduction of this fungus. This is the interesting part. What is the pathophysiology, or how the mucormycosis results and why in COVID-19 patients? In a healthy individual, we have a strong immunity, healthy individuals. So even if the fungus is available in the environment like this, we inhale it. The fungal spore reaches the lungs. Okay, in the lungs we have the alveolar macrophages. These macrophages will phagocytize, or they eat up these spores and they are destroyed. So we have a strong immune system which can destroy the fungal spore even if we inhale this. But what happens in a COVID-19 infected patient? Because of the weak immunity, the primary infection here is COVID-19, and that has reduced the immunity. So this fungal infection, mucormycosis, is called the secondary infection. It usually happens due to weakened immunity. Okay. So once the fungal spores enter here, now this starts germinating here. I told you previously, germination of the fungus, and once they germinate, they sprout like this within the lung, resulting in pulmonary mucormycosis. A large amount of these sporangias are formed here. They will start spreading through the circulatory system to the various areas like eyes, paranasal ear sinuses, nose, mouth, palate, all these areas. This is because of the weakened immune system. The macrophages are not that effective in clearing these spores which is being inhaled by the patient. So this is the pathophysiology of mucormycosis. Hope you understood this. Now coming to what are the symptoms of mucormycosis. Please note these are the following symptoms. If the patient develops facial pain, especially on one side, hemifacial pain, facial numbness, woody sensation on one side, headache, unilateral headache or eye pain, swelling in the eyelids, blurring of the vision, this decreased clarity in the vision, nasal congestion means nose blockade. Later there is a discharge from the nose which is blackish in color. Also if you observe the mouth and the nose, there is black lesions within the mouth, especially in the palate. It is in the roof of the oral cavity, there is palate, black lesions. Some patients also develop toothache. Ultimately they lose the tooth because the fungus has grown through the root of the tooth. And fever, high grade fever will be there, and chest pain for some patients in pulmonary mucormycosis. What are the risk group for developing mucormycosis? So mucormycosis doesn't come in all patients with COVID-19 or all patients who have received steroids. That is a wrong belief. Okay, mucormycosis comes only if the immune system is low. The immune system is weakened or it's low, it's not functioning properly. In whom does it happen? These are the following scenario. Uncontrolled diabetes mellitus. The HbA1c is too high, below 8, 9, 10. So that means it is uncontrolled. They are not controlling the blood sugar. So the sugar is freely available everywhere. So fungus starts growing. Cancer patients who are on immunomodulators. So cancer patients have irreversible growth of the cells in their body. So they are given immunomodulator to reduce the growth of these cells. Also these immunomodulators reduce the growth of other cells also, including immune cells. So thereby their immunity is reduced. So these patients are prone for any fungal infection including mucormycosis. The same thing goes well for organ transplant patients. In organ transplant patients, they are also on immunosuppressants so that the immune system does not reject the transplanted organ. But here, since the immune system is suppressed, mucormycosis can occur in these patients. Next, interesting thing what you are expecting. COVID-19 infected patients who are given broad spectrum antibiotics and steroids, their immune system is reduced. So therefore, fungal infection, mucormycosis. Other way of getting this infection is the humidified oxygen for a longer duration. The water in which the oxygen has been bubbling and coming into the respiratory tract of the COVID-19 patient. That humidified oxygen may contain this fungus, so that can result in mucormycosis only if the immunity of this patient is low, not in all patients. I am again stressing on that. So what is the treatment for this mucormycosis? So there are two treatment options available: medical treatment and surgical treatment. Medical treatment is injection amphotericin B. This should be given only in the hospital setting. Surgical treatment is debridement, meaning removal of all the infected tissue, that fungal tissue, which is the human tissue which has been destroyed by the fungus, including the fungus, has to be removed. That is a surgical debridement or removal. How to reduce the risk of mucormycosis? If you follow the following measures, then we can minimize the risk of mucormycosis. Usage of the mask in dusty environment. I told you this fungus is present in soil. So in dusty environment, if you use the mask. Wear shoes, long pants and full sleeved shirts. This is to prevent the anchoring of this fungus on the body surface. So if you cover your body, majority of the body, it will not be carried on the surface of your body. Use gloves while handling soil or manure. So I told you this fungus is present in soil. So especially in humid environment, wet climate, it will be there. So better to use gloves whenever you are handling some soil or manure. Dispose of the spoiled food. Fungus grows in spoiled food, so it's better to dispose the food before it gets spoiled or once it is spoiled. Maintain personal hygiene. That is, we should be careful about the mask which we are using, especially if it's a reusable mask. We have to wash it and clean and wear that mask. Otherwise, this fungus can grow in the mask as well. Control the blood sugar level, especially in a diabetic patient. The blood sugar level should be controlled. Otherwise, the fungus will feed on the high sugar which is present everywhere in the body, including the lungs. Treatment option I already told you. Mainly medical line of treatment is ambulatory symptom, surgical debridement of the tissue. Other drugs include posaconazole and isavuconazole. These are also antifungal agents. Thank you for watching and learning from Medico. Like and share this video with your family and friends to create awareness. Kindly press the thumbs up icon if you like this video. Subscribe to our channel for getting the latest videos. Press the bell icon as well. Thank you for learning from Medico.